I am from Panama City. I was born and raised there, and when I was about 15 years old, I had the opportunity to spend 3 months in Albany, New York. And at that time, I learned the language, and I was able to communicate effectively, and I was able to meet other peoples and other cultures. After that, I went to medical school in Panama, and after about 10 years of training there, I decided to come here and to pursue my career in physical medicine rehabilitation. I did my residency in the Mercy Hospital of Pittsburgh. I spent 4 beautiful years there, and after that I decided to do something else. So I decided to do electrodiagnostic medicine. So I spent an extra 12 months at the Medical College of Wisconsin and would obtain an electrodiagnostic fellowship. Electrodiagnostic medicine, it has been a passion for me since I was a little kid. I love physics and I love formulas, and I wanted just to do physics. So I never wanted to be a doctor. I wanted to be a physicist. I wanted to, everything has to be solved with formulas, with currents. And so when I learned that physical medicine and rehabilitation, one part of it was electrodiagnostic medicine, I just jumped into it. The things I like the most is giving back to what they have lost. If a patient lost the legs, a patient with an amputation, you give them back an artificial leg, and they're able to engage the family. They're able to jump out of airplanes. They're able to go back horsing. They can ski. They can do anything they want. The conditions that in physical medicine and rehabilitation treat is mostly all patients with disabilities. Patients with MS, multiple sclerosis, strokes, traumatic brain injuries, spinal cord injuries, for pediatrics with cerebral palsy, patients with post-polio syndrome, or other disabled conditions, also basic things like osteoarthritis, back pain, neck pain, or fibromyalgia. Anything that would prevent a patient to perform their activity of daily living. If a patient with fibromyalgia is in a lot of pain and they can't even get up and go to work, or get up and go take care of their kids, that's what I'm here for. The second part of my career is the electrodiagnostic medicine, and that is to do accurate diagnosis. If a patient has nerve problem, and it's important to diagnose it, to treat it. So if a patient has hand pain, it can be just for arthritis, tendinitis, or it can be something as simple as a carpal tunnel. Another thing that I think I bring to the table and I bring to this region is the use of botulinum toxin. Botulinum toxin, Botox is the most common one, is currently used for wrinkles, but I use it as a indication for spasticity. Spasticity is when a person, after they have an injury to their brain, it could be a stroke or a spinal cord or a muscular sclerosis, the limbs go stiff. They go like this. So the hand go into their fingers go into their hand, and they're unable to open, and for hygiene and for dressing, it's important for them to open. So I give them botulinum toxin in their muscles for them to be able to relax, and they're able to be more functional. Other indication of it will be something called torticollis or cervical dystonia. Cervical dystonia, it will make people miserable. It will make their quality of life horrible. So we will use botulinum toxin for that as well. When the neck is like that, they can't drive, they can't engage their life. So that would be another indication. And the third and current indication is headaches. So the FDA has recently approved for treatment of headaches, and I think that's something that would greatly benefit headaches with botulinum toxins. So physical medicine rehabilitation is a specialty where team approach is the most important part. I use psychologists, I use physical therapists, occupational therapists, speech language pathologists, I use neurologists, I use GI physicians, I use the whole personnel to help me provide better care. An example, that patient that has a stroke, patient that has the spasticity, I will give them the botulinum toxin injections for the patient to stretch. But the most important part of that is to go ahead and stretch. So the occupational therapy has to do that. Then I have to give a splint to continue the stretching. The orthotics and prosthetic people will do that, and so forth. So I think the team approach is really, really important. And to know that I am not the center, the physical therapy is not the center, the patient is the center of the healthcare, nobody else. I think it's really important to integrate things that I do at my practice. One of them is the daily approach with electrodiagnostic medicine. If patient, when they have pain or they have lack of movement of one limb, we need to know why. So electrodiagnostic medicine is a very important tool for this. So I have some cables here that I can show you how is the electrodiagnostic is done. It's very simple. Some of the cables are put in your finger, and that way the patient gets some electric shocks, and it measures the velocity of the nerve and the size of the nerve, and that can tell me if the nerve is slowing or the nerve is going at the right velocity. It's not painful. It's uncomfortable but not painful, and it's done in 15-20 minutes, and you have the response immediately. The second part of the study is a little pin. It's an acupuncture needle. Again, it's a little bit uncomfortable, but most of the people tolerate it pretty well. A lot of people have come to my office and said, Dr. Jones, you have changed my life. One story that really caught my attention is when I was in training, we had a patient, it was a burn. It was an electrical burn. He was an electrical worker, and he grabbed his hand and he got amputation of the left hand and bilateral lower extremity. So he had only one hand and three stubs. And that patient was able to drive. That patient was able to dress themselves, feed themselves, and be ambulatory with a wheelchair. So I think all the team approach and everything you can do for that patient, from functional, for pain, for education-wise, I think is really, really important.